Hello and welcome to the Headache Doctor podcast. Where on this podcast, it's our mission to educate and empower everyone with headaches and migraines so that you can break free from a life of fear of your next headache or migraine and dependence on medication. In today's podcast, we are interviewing another patient that successfully went through our process. This is Audrey Short, and what's unique about her story is she's actually a physical therapist, and a very good physical therapist, and her husband's a good physical therapist. And so it's interesting. We're going to talk about why she chose to work with us and get more into the details of like physical therapy and our profession and why what we're doing is unique, but mostly about her story. And I hope you guys relate to it. So thank you so much, Audrey, for being on the Headache Doctor podcast.
Yeah, thanks for having me here. I'm excited.
All right, so let's start off with giving the people, the listeners, a picture of where this started for you. So when did you have your first headache or migraine? Where did the journey start? And then we can go through different things like the types of providers you worked with, the things you tried, that sort of stuff. But give us your story.
Well, I would say I've had experiences with headaches the majority of my life. I can remember as young as in elementary school having what I would consider to be a really bad migraine, but that was, maybe like once every few years. It was not frequent, anything like that. They definitely started to ramp up the older I got, and by that I mean high school, college, that kind of a thing. I almost separate having headaches and migraines a little bit as well. For me particularly, a headache is just more maybe some neck pain, some pressure at the base of my skull, but it's not distracting me from doing what I need to do throughout the day. When I would get a migraine, that would just be pain intensified. It would typically, I could feel it start at the base of my skull. It would feel more intense. It would start to wrap around the top of my head. Sometimes I would feel an ice pick sensation, kind of like stabbing me behind the eye. And I would just be down and out for however long that would last. Before I even started trying to take medication when I was younger, I would just have to sleep it off. So whether it was starting at night or in the middle of the day, I would have to stop what I was doing and pretty much immediately just go lay down and sleep.
Yikes. What was the frequency back then of the migraines?
Back then, the migraines would be very rare. They would probably be once every 2 or 3 years. I think it really started to get bad when I was in college and probably grad school through PT school.
Okay, yeah, PT school did it to you.
I would do it, yeah. I can relate.
Yeah, so when you were a kid, what was the point where you and your parents decided, hey, we need to actually go see a provider? Do you remember if you were taking medication at that time or what types of treatments you were going through?
Yeah, I don't think we ever actually sought care for it because it was so sporadic. Mm-hmm. And we would probably just, say, oh, you're tired, you're really active, you're playing soccer, you're in school, all these things. So they would either say, hey, here, take some Advil or take some Excedrin migraine and call it good. And it worked, it was, very musculoskeletal treatment for something that was pretty musculoskeletal. Not that I knew that at the time, but I was like, oh, hey, like 2 Advil worked, great. But of course, over time, that had to start ramping up. How much I would take, or eventually progressing to Excedrin migraine, taking 1 of those, but then eventually needing to take 2, which is their recommended dose. And eventually got to the point where, oh, hey, Advil's not going to work. I just need to immediately, the second I start to feel a headache, be out of fear of it turning into a migraine, let me go ahead and take Excedrin migraine.
Yeah. Okay, so that the time frame of infrequent migraines to ramping up, needing to take more and more medication, that lines up with physical therapy school?
I would say it probably does.
Okay.
Yeah. A lot more sitting, studying, stress.
Yeah.
Always looking down at something, whether I was taking notes, looking at the computer. And I think it really hit home for me more so when I started doing clinical rotations and I got out of that student posture and was up and moving and interacting with patients and just generally being more active throughout the main part of my day. And when I would go back to school and have to sit and study again and look down all the time studying for boards, I noticed, oh, like my neck is starting, like, oh, I need to pop it, something like that. And headaches would ramp up again.
Okay. So when you were in physical therapy school, seeing this connection between sitting as a trigger or something that increases symptoms, did you realize, oh, this is probably a neck issue? Or what was in your head as far as the source of the migraine itself?
Yeah, I think during that time, I did attribute it mostly to a postural connection of some sort. Because I almost found like I would have to hold my head up in some way if I was looking down for too long.
Okay.
I'm like, okay, I'm just in a bad position. This is got to be coming from this general region then, very much so.
Yeah. Did your head feel heavy? Like you would just like get fatigued throughout the day type of thing?
Yeah, for sure.
Okay. That is something we hear quite a bit, that people feel like they can't find a comfortable position and that their head just feels like they don't like to be upright. Okay. So through physical therapy school, symptoms seem to ramp up associated with sitting. You're just basically taking more and more medication at that time. Okay. And your presentation of like the symptoms themselves, it was like pain in the back of the head, wraps up and around. Is that right?
Yes. Yeah.
Okay.
And I would say, I don't think I knew at the time it was really coming from my neck as much as like the base of my skull. So those were things that I eventually learned just with experience and working in physical therapy of, oh, this is cervicogenic, this is stemming from my actual spine. It's not just my head. But it took time to get there and just experience and knowledge. But it really would start from the base of my skull. I think my neck would feel tired, but the pain would be higher. So there was also maybe like different sensations I would feel depending on what part of my neck I was thinking about or what part of my head I was feeling about. And then it was just always pain around my head.
Yeah.
Pain and pressure.
Right. Okay. And when you were like sitting in a classroom and you realized, okay, this like prolonged sitting is a trigger, did it tend to be you'd wake up and you'd be fine, and then as you went about your day and the more sitting you did, you'd kind of feel the symptoms onset, that type of thing?
Yeah.
Okay.
And I think that's why when I would start to feel a headache morphing into what I felt like would be a migraine, I would just try to lay down as quickly as possible, honestly.
Yeah.
If I could get medication into my system fast enough, it could probably help it. But I kind of just thought, all right, I need to sleep and not be upright against gravity anymore.
Yeah.
Yeah.
We have a lot of people that seem to see an increase in their symptoms when they're in college, grad school, that type of thing.
Yeah.
What were you feeling during that time? Was this a significant barrier, or was this something like easily managed with medication?
At the time, it was easily managed with medication.
Okay.
And I think it was because I was still young. Like I was still in my early 20s. Your body bounces back a lot faster. And I was still trying to maintain activity as much as I could. I was still running a lot, after class. I was still strength training. So that was able to offset, I think, a decent amount of it. But I would say even after getting out of PT school, moving on into working, things still started to ramp up again at some point. It took a while for that to happen, but it's not like everything fully went away when I was out of those seated postures.
Yeah. Okay. And still just managing with medication, hadn't really seen any providers. So when was the point where it ramped up enough where you thought, okay, I need to actually find someone who can treat this?
I would say there were probably two moments. One where I thought, oh, I should do something about this and didn't. And then another one where I did. So the first one was, of course, in our beloved 2020 when everything was crazy. Obviously, there was a lot of stress just around the global pandemic. But on top of that, I moved out of the home that I was living in with my roommate because she got married, and I ended up renting a place by myself.
Okay.
And I can look back on that now and think like, oh, that was probably stressful in and of itself, because here I was, a single woman living alone in this home in a different neighborhood. And I vividly remember waking up in some of those first few weeks with so much tension to the suboccipital region of my spine, burning, like a lot of burning. It felt like just constant lactic acid buildup almost is how I can equate to it. And that just did not go away. I had also changed jobs, so there were a lot of moving factors at this point. And I remember thinking, I should really probably look into this because this is not something that's just going away. I went through a process of buying different pillows, sleep position, and that played a role. But that was a time when I probably should have done something about it. But I thought, I'll probably work through this. My body's just going to go through something and it'll be fine. And that was probably the start of me being in this chronic phase of a lot of ebb and flow of headaches, migraines, neck tension, and so on and so forth. So that was the first time. The second time was more recent, was actually last year, I guess. July of 2024. I woke up and I just was jammed. Like I could feel, I could not look to the left. I could not tilt to the left. My range of motion was very restricted at a very localized area. And that's when I thought, okay, this really isn't good. Medication isn't touching this. I took Advil, was not doing anything. And here I am trying to work, and I'm rotating my whole body try to do my job and document and work on people. And that's when I ended up thinking, okay, well, let me go seek chiropractic help then. They're really good with joint mobility, and I just feel I need some kind of movement of my joints, and I need it now. That's the thing where I was like, I need something to move now. So it was kind of like this desperation feeling of just get it going. And I think I felt like this for maybe 2 or 3 days. Found somebody, went there, and I could feel it. They did get a pretty significant, we call them manipulations. Chiropractic care calls them adjustments, on both sides of my neck. They did some work to my thoracic spine. They did some work to my lumbar spine. They took the x-rays. My spine didn't look terrible. I could tell I had tension. You kind of feel that you have tension. And I went back for, I think, 3 follow-up visits. And each time my symptoms would have relief for maybe 30 minutes. And then symptoms would come back. So I'm like, this really isn't solving anything.
Yeah. So one thing I want to ask and get more insight into is you're a physical therapist. You went through physical therapy school. You're practicing as a physical therapist. Your education insight tells you my neck has a problem. And when push comes to shove and you're like, okay, I need to do something about this. Well, it's 2 questions. Okay. They're kind of the same, but the first question is, what in your education was helpful for understanding that, and what is the gap? Why did it not lead to a solution itself? And then also, which is kind of the same question, why did you go directly to chiropractic? And from my perspective, there's no no criticism, or I'm not judging that decision. I think it's actually it's really insightful, and so I want to expand that a little bit. Yeah.
So with my experience in physical therapy, I started off working in outpatient orthopedics. So I at least got my hands on a variety of diagnoses all over the body. So I had at least worked on enough cervical spines and headaches to have familiarity enough of, wow, my joints need to move.
Right.
This isn't just a little bit of tension. This is joint restriction. So I knew I kind of had in my mind 2 ways to go. And I didn't really think, I wasn't fearful that it was a neurological condition because I had responded to other musculoskeletal treatments.
Right.
So
which would be your training.
Yes, exactly. So I had already ruled that out. I kind of know these red flags and everything, which is helpful. So I thought, of course, there's chiropractic care and there's physical therapy. Well, there's a combination in physical therapy of, I think that's long-term what I'm going to need, but I know the system so well that, first of all, I'm going to have to take time off work for that. Really hard to do, especially in healthcare. You have people that are relying on you to be there. That's going to be a long-term commitment.
Yeah.
Right? Sometimes places, physical therapy, especially where I was working, we were really booked out. Like, we're super busy and I need something immediately.
Right.
And then I'm like, okay, well, chiropractic care, like that model is set up to have a lot of capacity for high volume patients for them to just be able to do like a quick treatment. Right. And I've had so many patients come and tell me their success stories with chiropractic care.
Okay. Yeah.
And I was like, maybe I should be a little bit more open-minded, because leading up to that, I was like, never see a chiropractor. Literally, like that really was me. I was like, oh no, I don't believe in that. And there are certain aspects of that model I still don't think I agree with as a clinician, but that doesn't mean that their skill set is poor. Right. And so I went to a place in town, and they were very kind people. They educated me on what they found based on their scope, and they were able to move my joints, right? But that wasn't the whole picture. So that's where I think some of that treatment was lacking for me and what I needed. It wasn't the entirety of what my body needed to retrain, essentially.
Yeah.
So.
Yeah. Can you also speak to Novera Headache Center? We're specializing in headaches and migraines. The whole reason is because it felt like this wasn't a thing that people could get access to. Lots of very good clinicians out there, and even in your experience, like treating headaches. I'm curious what your perspective is, and this is maybe a dangerous question because I actually don't know what you're going to say.
Love this already.
But yeah, like, what is your perspective on like, hey, just go see a physical therapist down the street compared to, like, why did you come to see us when it came time to go see a physical therapist?
Yeah, that's a great question. I probably have a few answers to that. So I specifically do pelvic health now. Mm-hmm. So I've had the privilege of working in the pelvic health field pretty much solely for the last 5 years. And when you get to specialize in a niche like that of physical therapy, you can throw your whole heart and soul into it, right? And you can start to identify the components of an entire person, not just their spine, right? Mm-hmm. Not just this one muscle in their treatment. And that's such valuable information to know what that person is walking through day to day that needs to be included in their care. So in my mind, I was thinking, I need to find someone who targets this area of the body, because they are going to know the neuroanatomy. They're going to know, of course, the musculoskeletal system. They're going to know the joint framework. They're going to know the ins and outs of this a lot more than even I'm going to. As a clinician, I can bring my piece of what I'm feeling and my expertise in my own person. But as far as how this area of the body functions, I find so much value in going to someone that you can trust that spends their time doing this specifically. Right. And I think had I not been working in the whole pelvic health industry for the last 5 years, where I've had access to do that for my clientele, I wouldn't really know that.
Yeah. No. Yeah, and that's really how our healthcare system is set up, where, you have primary care doctors that, have a large breadth of like their understanding. Maybe it's relatively shallow, and then you have the specialists that go deep into those scenarios. So, one of the things that oftentimes comes up is, well, can I just go see a physical therapist that's in network, or like that's, down the street? And of course, like, you can. Right. And so, but communicating the value, I think it's helpful to hear your perspective, because, that's also, that's like, I believe that that's true. Like, I believe that we are going to do a better job than other therapists in town when it comes to treating headaches and migraines. Right. Now, if you have low back pain, I do not believe that we're going to do a better job. I will do the best I can. And sometimes friends and family come in for like low back stuff, but like, we've found our niche, and I would trust us over anyone else. Okay. So you get to the point of realizing I need to go see a physical therapist. What was it like starting the process with us? Like, what are some thoughts you had or feelings you had? Like early on.
So I would say when I had that first, it wasn't like a discovery call because I was physically here, but kind of just that first assessment.
Discovery visit, yeah.
Yes, perfect. I got to work with Dr. Gawain, which is great. And he did a really great job of just, first of all, recognizing, hey, you're a PT. I can kind of talk shop to you, which is great. He didn't feel like he needed to sell me on anything, which was really helpful. I was like, hey, this is what I'm feeling. It's very cervicogenic. Like, see what you're going to feel. And he was able to verbalize, hey, this is what I felt. Like, these are the segments that I noticed. Like, this is like muscular structure, kind of what I'm feeling. So it was validating more than anything of like, okay, I am on the right track. I'm at the right place. Of course, we can always talk finances too. I mean, this is an investment to come to an out-of-network provider. When I decided, and I ended up having that initial evaluation that same day after the discovery visit, because again, I think I got to the point where I realized I wasn't going to have any quick fixes if I wanted to maintain the trajectory of like my life and my activity and my job. So I needed to do something about it. So when I went home and I talked to my husband, also PT, about, hey, this is the price, this is what it's going to look like. You know, he said, honestly, like, you know, we just got married last September. He's like, if we can justify, you know, paying what we paid to provide food for everybody at our wedding, we can provide financially for you to have your health, you know?
Yeah.
And when you start to compare the costs of what you're paying for other things that maybe you quote unquote did or didn't need, then it really starts to hone in on like, I do need my body to work.
Yeah.
You know, again, working in the field that I work in, I see postpartum moms all the time. And 9 times out of 10, they're going to come in and say, yes, I have pelvic floor issues, but my neck and my shoulders are absolutely killing me because they're carrying a little baby, they're nursing, they're bottle feeding, they're doing all these things that are different for their body. And I'm thinking, well, gosh, when we start to have kids, like, what is that going to look like for my neck if I'm already like this and I don't have kids yet?
Right.
It's terrifying. So it was like all these big things. And I was like, no, I need to make sure I come to people who will sit down, work on my neck. It's not just going to be 5 minutes of hands-on work and, oh, hey, here's your home exercise program. You know, you can do all this stuff at home and I'm only going to work on you for a few minutes. Like, I need some actual hands-on work. That was another big thing.
Yeah.
So,
I think, I haven't, well, maybe I did meet your husband briefly, right?
I think
or no?
So. You may have. He knows of you. I will say he knows of you.
Okay.
Because he's like, yeah, the guy with the bow tie.
Yeah, I wear bow ties.
Yeah.
I like him. And I appreciate that reasoning.
Mm-hmm.
I think it was last year my car's AC went out. And just so you're aware, listening to the podcast, going through a full plan of care is somewhere between $3,000, $4,000. And I go to the mechanic and I think they quoted me at, it was like $3,600. And it just struck me like I can get cold air blown in my face or like life-changing migraine treatment. And it's like the same cost. Mm-hmm. And if you zoom out, like, work done on my house, it feels like every time someone comes to my house, it's like thousands of dollars. And I'm like, man, like I chose the wrong career path. Like, like I could have, not minimizing what they do, but, anyways, like like things are expensive. Yeah. And so, there's definitely this sort of perceived barrier of, oh, this isn't a network. And a lot of people are somewhat fearful to step into that. Maybe they don't identify with it. But ultimately it's just, what do you value your health, and is it worth that investment? And then it's up to us to take someone along and show them that they can trust the process and that we can truly help. Okay, so what was your experience like as far as where you started and how you're feeling as far as like your symptoms, your headaches, your migraines, and then like how quickly did it respond, and what are the results? Like how are you feeling now? That type of stuff.
Yeah. I'm feeling really great now. My range of motion is pretty much fully restored, which is great. It was crazy that for about 6-7 months, I just could not turn my head fully without feeling achiness and pain or just not being able to have range of motion. It was wild. Through the process, I would say I can confidently say like it was pretty up and down. And I think my notes would reflect that, at least in the beginning, because we had so much to work through. Yeah. And there were so many factors. But what I can say was that continuing to come, especially consistently, and I came consistently like 1 time a week for quite some time, that was able to almost prime my joints and my muscles to learn the mobility that needed to be restored. That way, when I was consistently doing my home exercise program, when I was hydrating well, when I was sleeping well, when I was managing stress, the rest of my body, when all of that was kind of lined up, man, my neck turned around super quickly. So what Dr. Gutwein also did a great job of was updating my home exercise program when I asked, hey, I think I actually need a little bit more strengthening. What do you think? I'm loosening up well, but then symptoms are coming back. Can we do a little bit more of that? And again, that just goes into my expertise of like understanding my body more than anything. And he's like, yeah, let me give you a few exercises. Those worked really well. That was like one of my first hurdles that I would say we kind of worked through. And then he kind of knew me again as a person, knew I was going through a lot of stress at the time. And so some of his questions when he would ask me how I was doing, it wasn't just about my neck. It was, hey, how's your stress? And I could say, it's actually really bad right now. And he could probably feel it, and we can talk about like the vagus nerve all day long, go back and listen to that episode. Actually, it's really great. But when things kind of lined up and I was in better sleeping positions, my stress was managed, things really started to turn around quite a bit because my neck had been prepared to move again.
Yeah. So. Yeah. I think, the movement is something that patients oftentimes notice, like, hey, I can move my head easier. Mm-hmm. What's unique about your situation is your background as a physical therapist and being able to identify that that's connected mm-hmm. to your headaches. And so having the confidence of like, I know that my neck needs to move better is, it's a really great starting point for us, because sometimes we have to bring people up to speed on like, hey, here's the actual problem. Yeah. And then the other thing that leads to success, well, 2 things. One, you highlighted the consistency. If someone's going to fail our process, is because they are not bought in. And so one thing that we actually build into the structure of what we do, and I was really hesitant to do this at first, but actually having like a packaged, this is our plan of care. Yeah. Because that felt like, that's kind of a chiropractic-y salesy thing. But I actually had patients tell me like, hey, if you did that and gave us discount, we'd do it. Yeah. And then what we realized is like the more committed people are, the better they get. And so if they just like commit to the process, we do the process, and like there's ups and downs with most people, but if they're committed, like we almost always get the result that we're looking for. And the reason people wouldn't find success can be either because they're not compliant with what they do at home, which is the other thing of like doing the things we tell you to do at home, and then being consistent. So yeah, I never worked with you. Yeah. And so this has been fun to like, go into the details of your story. Yeah. Yeah. And good thing is there anything bad to say about Dr. Gutwein that I can kind of evaluate him on?
We can always like talk about it off the podcast.
Yeah. Okay. Yeah, totally.
But I would also encourage patients, whether they're coming here or anywhere, just don't be afraid to tell your PT if something's not feeling right, or like, don't be afraid to talk about the flare-ups. Like we kind of expect that, like we as physical therapists, we need to know, because that means we're at least making change, and then we can guide patients through that. So I don't want people to feel like they're doing worse if they have a hiccup or a setback or a flare up, like this is about learning how to listen to your body. That way, when someone has made it through your program, either A, they can come back for a quick tune up if they start to feel something, or they've gained the skills and the knowledge to understand what's going on, and they don't have to fear it anymore. Right. So it's not like you're trying to achieve perfection of maybe like, I will never for the rest of my life ever have neck pain again. That's probably not going to happen. But will you have the tools to manage it and a place to go if you feel like you can't? Absolutely. Yeah.
I love that, because it's so true. Yeah. And just for context, you are specializing in pelvic health. which is amazing. And there's definitely connections between headaches, migraines, and the pelvic floor.
Significantly.
Yeah. And then also for our listeners, if you're local and you're thinking like, what about the PT down the street? She's on the podcast right now. Like, this is the PT down the street. So, we have great PTs in Colorado. I think we're probably one of the better states as far as like our Practice Act allowing us to do things that maybe other states don't allow. And then oftentimes the good physical therapists end up specializing and, maybe communicate a little bit about like pelvic floor and its connection to headaches or migraines, or like what you see in your own practice.
Yeah. So I will typically screen most of my patients when they come in and ask about obviously all their pelvic floor symptoms, but if they have any foot or ankle dysfunction or any neck issues, and I'll phrase it very openly, see how they answer. And I would say 8 out of 10 times they're saying, yeah, I have chronic neck pain and headaches.
Really?
And also like, it's not a big deal. Of like, yeah, of course.
Right.
Like,
doesn't everyone?
Yeah. I was like, that's not good. And TMJ dysfunction, right?
Okay.
I think there is a huge connection with the vagus nerve, honestly, and just how our parasympathetic system is or is not regulated.
Right.
When I have pelvic floor patients, I mean, they're super uncomfortable with their symptoms, right? And that's going to run the gamut of, chronic pelvic pain, incontinence, constipation, any form of discomfort, abdominal pain. They typically don't understand their symptoms either, and they've been through the ringer as far as healthcare goes. So I think there's a huge connection with just how it starts to flare up that fight or flight response. General body tension and central sensitization is happening, and then you have all of this cervicogenic dysfunction that's just feeding up the system and then catastrophizing everything. It's right. It just kind of goes in this cycle. Likely poor sleep as well. That's going to be a big one. It's very connected just through how our body responds to stress, honestly. Yeah.
So here's what you're going to do if you live in Colorado Springs and you have headaches and then some need for pelvic floor therapy. You're going to see Dr. Short, and then you're going to come here to Novera Headache Center, and your life's going to be changed.
And we're super close to each other. We're not far away, the clinics.
Yeah, that's what I'm saying.
Yeah.
So, and I'm literally going to tell, so if the next discovery visit that comes in, and if this is you, be warned, and says like, well, I'm going to check out the PT down the street, I'm going to say, well, you can, but she comes to see us also.
Exactly.
So
you might run into her here.
Yeah, you can't escape us.
Yeah.
All right. Well, yeah. Audrey, thank you so much for being on the Headache Doctor podcast. Any other final thoughts before we wrap up, or encouragements?
I mean, thank you for helping me get my life back. I really do appreciate that, and everything you're doing here and on the podcast, just kind of getting the message out. I'm big on education for people and just having access to that. And I feel like that's one of the main things that's limited in healthcare right now.
Yeah.
So we appreciate that.
Yeah. Well, thanks for being a part of the podcast. Yeah. And I think this will be a very well-loved episode, and one that we'll send out to people and make sure people are aware of. And if you have need for a pelvic floor physical therapist, you need to, you don't need to wonder any longer. You know where to go.
Appreciate that.
Yeah. So thank you guys for listening to the Headache Doctor podcast. As always, it's our mission to educate and empower everyone with headaches and migraines so you can break free from a life of fear of your next headache or migraine and dependence on medication. I'll see you next week.